Assalamu alaikum. So the last lecture of Introduction to Anatomy starts here. It includes the terms used in clinical anatomy. Okay, these are very important terms which we'll use again and again in the coming period when we'll further study the anatomy. So let's get on with it. Okay, so whenever you see the term itis, okay, there are two terms here. Okay, one is prefix and one is suffix. Prefix is anything that comes before a term. Okay, just like hypoplasia, hyperplasia, anaplasia. Here hypo, hyper, ana are prefixes. Okay, and plasia is a common term. Whereas the suffix is any term which comes after a singular term, just like itis, ectomy, otomy, appendicitis, tonsillitis, neuritis. Itis is the suffix. Suffix is that which comes at the end. Okay, so let's study some common suffixes. So the first suffix here is itis. Wherever you see this word itis in the end of any organ's name, it means inflammation. For example, appendicitis means inflammation of appendix. Tonsillitis means inflammation of tonsils. Arthritis, inflammation of joints. Neuritis, inflammation of any nerve. Dermatitis, inflammation of skin. So itis means inflammation. The second suffix here is ectomy. Ectomy is used whenever we surgically remove some tissue or some organ. Then we'll use this term ectomy. For example, appendicectomy means removal of appendix. Tonsillectomy, removal of tonsil. Gastrectomy, removal of stomach. Nephrectomy, removal of a kidney. Okay, it may be partial, it may be complete. Like in partial gastrectomy, we remove a part of the stomach that is affected by any carcinoma or anything else. Whereas in total gastrectomy, we remove the whole organ. Okay, then there is the suffix otomy. Otomy means whenever we surgically open up a closed space or a hollow space, such as laparotomy. Laparotomy is whenever we open the abdominal cavity to remove any pathology. It can be damaged, lacerated liver. It can be absolute constipation. It can be anything else, like if there is peritonitis, we open the abdomen. That is laparotomy. It is a major surgery. Hysterotomy means whenever we open the uterus to remove a dead fetus or any kind of tumor or carcinoma. Okay, cystotomy is when we open up urinary bladder. Okay, remember, cysto is used for urinary bladder, hystero is used for uterus. Cystolithotomy is whenever we remove stones from the bladder. The suffix ostomy. Okay, ostomy means to open a hollow organ and leave it open. Okay, so I'll give you an example. In cystostomy, colostomy, tracheostomy, what do we do? Okay, if there is any foreign blockage in the tracheal tube, or due to road traffic accident there is a crushing injury of the trachea. Trachea is the windpipe through which we breathe in the air. So if there is crushing of trachea or blockage of trachea, we use a technique that is known as tracheostomy. After that, we put in a tube through which the patient can breathe. Okay. The thing with colostomy is when there is absolute constipation or an imperforated anus, when there is no anal tract in a child, in an infant, or when there is Meckel's diverticulum, some kind of pathology of the gut of the large intestine or small intestine, we do colostomy. What is colostomy? In colostomy, we cut off the colon, large intestine, and attach it with the abdomen. and we make up a new tract for the feces to pass out of the body. Same, there is cystostomy. In cystostomy, we open up the urinary bladder if there is any pathology, any blockage, any inflammation, and we make a new tract, new way for the urine to pass out of the body, despite of urethra. If there is imperforated urethra, or if there are some kind of you can say blockage in urethra, then we do the cystostomy. Okay, oma means a tumor. Specifically, if there is only oma written, it means a benign tumor. Okay, what is a benign and what is a malignant tumor, we'll study it in the future. I'll let you know what is the difference between benign and malignant tumors. So here, lipoma means a benign tumor of fat cells, osteoma a benign tumor of bone, neurofibroma a benign tumor of nervous system, hemangioma a benign tumor of blood vessels, carcinoma is a malignant tumor of any serosal surface. Okay, the next terms. What is puberty? Puberty is the age at which the secondary sexual characters start appearing in a man or a woman. Okay, so in males, 13 to 16 years is the age in which the secondary sexual characters develop. That is the development of pubic hair, the development of penis and scrotal structures, testes. In girls, it is 12 to 15 years. What happens in 12 to 15 years? Same, the development of pubic hair, development of breasts, and then there is menarche. Menarche is the starting of menstruation. Symptoms. Symptom means these are the complaints of the patient, the subjective complaints that the patient makes when he or she comes to you about and tells you about his or her disease. Whereas signs are the things which the doctor finds in the patient, which the doctor diagnoses in the patient. For example, a patient comes to you and says to you, Doctor Sahab, मुझे खांसी हो रही है, I have cough or I have pain here in the abdomen. Then the doctor observes and says, there is dry cough or there is productive cough, the cough is present for this period of time, that would be a sign. Whereas simple cough and pain in abdomen, as said by the patient, are the symptoms. Okay, so you can use a shorthand term for remembering these things. Remember, whenever a patient comes to you, doctor always signs. So okay, so where were we? Okay, signs and symptoms. What is the difference between sign and symptoms? To remember it, you can just remember this, that whenever a patient comes to you, doctor signs on the paper. Okay, doctor signs on the slip. So the signs are related to doctor. Whichever things doctor sees in the patient are signs. Okay, and symptoms are those which are told by the patient. It is so that you don't confuse these two terms. Okay, diagnosis is the identification of a disease or determination of nature of a disease. What does this mean? A patient comes to you with a simple cough. You say he has upper respiratory tract infection. Or a patient comes to you with loose stools. You diagnose it as a case of acute gastroenteritis or as a case of typhoid fever. That is the diagnosis, the name of the disease which you've diagnosed in that patient. Okay, so diagnosis is the identification of a specific disease. Prognosis is to guess the outcome of a disease or the probable outcome of a disease. For example, a patient of acute gastroenteritis, हैज़ा, जिसे उर्दू में हैज़ा कहते हैं, पेट खराब होना, मोशन लग जाना, डायरिया हो जाना, that has a very good prognosis. If he is given ORS solution, if the electrolyte balance is maintained, he has a good prognosis. If a patient of acute gastroenteritis comes to you and you do not give him any kind of liquids, you do not give him any kind of treatment, he's going to die. He'll have a bad prognosis. Same carcinoma, any kind of tumor which is malignant, has a bad prognosis, whereas a simple cough has a good prognosis. So there's that. Pyrexia is the medical term which is used for fever. The normal temperature of human body is 98.6, 98.7 degrees Fahrenheit, and I think 38 point something, 37 point something degrees centigrade. We measure it we always measure it in degrees Fahrenheit. So temperature more than 99 degrees Fahrenheit is pyrexia, it is fever. Edema. Okay, edema is accumulation of fluid in the extracellular spaces. Whenever you hit your hand against something, against the wall or something else, you can feel the swelling in your hand. It swells up. Or whenever there is a fracture of a bone, the part where the fracture took place, it swells up, increases in size. Why does it increase in size? Because of presence of extracellular fluid between the cells. In extracellular spaces there is increased fluid. That condition is known as edema. That is an example of tissue edema. There is another edema that is known as bronchial edema, in which there is excessive fluid, water, etc. in the lungs. Happens after drowning, happens after some lung diseases such as fibrosis and other diseases. We'll study it further down the road. Okay, what is thrombosis? Thrombosis is intravascular coagulation. Okay, the blood in the arteries and veins, it is a free flowing substance. It is a liquid. If it forms clots, okay, jam jayega khun inside a vessel and blocks its flow, that is known as thrombosis. And whenever that clot, that block is detached from that point and it travels further down the road and occludes something else, that is known as embolism. For example, there is a patient who has a leg fracture or an injury on the leg. The veins there, in the veins, the blood forms a clot there. Okay, that would be an example of thrombosis. If that clot detaches itself and through the veins travels to the lungs or to the heart and forms a block there, that would be an example of embolism or an embolus. Hemorrhage, simple bleeding, is known as hemorrhage. It can be external, it can be internal. What is external bleeding? What is internal bleeding? Whenever you get a scrape or a cut on your skin, there is bleeding from the skin. That is an external hemorrhage. That is example of external hemorrhage. On the other hand, if a person gets into an accident, ruptures his liver or his spleen or anything else, and the blood starts accumulating within the abdominal cavity, that is internal hemorrhage. Same if the person has a blunt injury and there is blood under the skin, जिसे हम कहते हैं नील पड़ गया, that is an example of internal hemorrhage. Also, whenever there is a breach or a gap in the surface or continuity of a mucous membrane or of skin, it is known as ulcer. होता क्या है? The skin is a protective surface that is over the body. Same in mucoid organs. These are mucosal surface that lines the inner surfaces. As in stomach, the stomach produces acid which helps in absorption of food when it goes into the stomach. If that and there is a membrane inside the stomach, the innermost membrane that protects the muscles of the stomach and other structures of the stomach from that acid. If that membrane gets damaged and the acid starts corroding the internal muscles and internal organs which do not have protection from that acid, that is an example of an ulcer. Same if we have a accident and we have a damage in the skin, whereas the upper part of the skin gets removed, the connective tissue gets removed and the muscles are exposed, that would be a good example of an ulcer. Lesion is simply any site of injury or inflammation or due to some circumscribed pathological changes. For example, when you have a injury on your foot or on your arm, that is a lesion, as simple as that. So any site of injury, it is known as lesion in medical terms. Inflammation is a protective mechanism that is initiated by the body on site of an injury. Okay, so it is the local reaction of the tissue to an injury or an abnormal stimulation caused by a physical, chemical or biological agent. Whenever we have infection of something, a bacteria goes into our throat and produces infection there. The body will react there by producing inflammation. What is inflammation? Inflammation has 5 components. In the books it is known as pallor, dolor, these kind of words, but the meaning of these words is there are 5 components. The first component would be swelling. It will swell up, increase in size. There would be pain on that site. There would be redness of that area. There would be increased temperature, warmth or heat at that area, and the loss of function of that area. All these factors, when they come into play, we say there is inflammation on that particular site. Okay. The difference between a sinus and the fistula is that these are abnormal tracts which should not be present at that site. The fistula has two-way communication, whereas sinus is a blind tract with only one opening. Okay, that is lined by epithelium. Okay, as you can see in pictures, as we'll study further down the road, the intestines in our abdomen, they are present in a convoluted manner within our abdomen. The purpose of intestines is to digest food and to provide a tract for the passage of food. Okay. On the other hand, there is urinary bladder that is located just inferiorly lower to the intestines. The urinary bladder holds the urine, and there should not be any communication between the urinary bladder and the intestines, because feces and urine are follow two different tracts, follow two separate pathways. If there is a communication between the intestine and the urinary bladder, and the feces start entering the urinary bladder and start coming out via urine, that would be a good example of fistula. Okay, and that is a very good example of fistula. On the other hand, a sinus is a blind opening, as happens in anal tract. Near the anus, near the opening of anal cavity, sometimes a blind pathway is formed where there is some fecal matter deposited. This fecal matter has only one side open, that is on the anal cavity side. Okay, if you don't understand any term or if you don't understand anything, just let me know in the group. I'll explain it along with pictures. I'm not including pictures because they are very grotesque. Okay, everybody does not have the stomach to view those pictures, so that's why I'm not displaying pictures here. So if anyone wants a picture of fistula or of an sinus, you can just let me know. I'll send it to the direct message. Okay. So necrosis. Before necrosis, there is a term that we need to understand. Okay, all of the cells in the body have a particular lifespan. Okay, all the living things have to die one day. Just like that, all the cells die. Okay, so uh, just like the red blood cells have a lifespan of 120 days. After 120 days, they are going to die, and new red blood cells are formed with the passing time. So the death is of two types. One is apoptosis, one is necrosis. Apoptosis is the automatic death or the programmed cell death. After 120 days, the body recognizes the old red blood cells and recognizes them as frail, as old cells, non-functional cells, and it just discards them. That is an example of apoptosis, in which the body is itself automatically killing those cells. Necrosis is a cell death or a tissue death or an organ death that is due to some other causes, pathological causes. Okay, maybe physiological, maybe pathological. Mostly it is pathological causes. Okay, so necrosis is irreversible damage to a cell that results in the cell or tissue death of that structure. Whereas degeneration is a change in which deterioration takes place in that particular tissue or in any cell, and but it is reversible damage. It may progress to necrosis or it may be reversed. A good example of degeneration is whenever somebody has a fracture of arm, okay, of the radius ulna, the lower bones of the forearm. We apply a cast over that fracture. हम प्लस्तर करते हैं ना, उसका प्लस्तर कर देते हैं. That is in place for up to 45 to 50 days. During that time period, that patient cannot use his arm, so the muscles go into degeneration. They are atrophied. Okay, so the muscle size is decreased, the muscle mass is decreased, function is decreased. That is a good example of degeneration. So when we open the cast, the patient starts to move the arm freely using the muscles again, gaining muscle mass, and it comes back to life, it comes back to its normal position. On the other hand, if we do not use it for a prolonged period of time, it may undergo necrosis, it may die. Gangrene is a form of necrosis in which putrefaction takes place. What is putrefaction? Putrefaction is whenever the cells die and there is production of some liquefying material or some gas. Gangrene is commonly seen in patients who have long-standing necrosed tissue, or in the patients of diabetes. Okay, in diabetic patients, whenever there is any kind of injury on toes or on arm or anywhere else, the cells do not have a rich ability to recover. They undergo necrosis and then they undergo gangrene. Infarction is death or necrosis of a tissue due to obstruction of its blood supply. Okay, mostly infarction occurs in heart. Whenever there is a blockage of any particular artery of heart, the blood is not supplied to that particular part, and due to diminished supply of oxygen, it undergoes necrosis. But it is sudden in nature, it is due to blockage of artery, so it is known as infarction. The infarction in heart is known as myocardial infarction because the cells of heart are known as, the muscular cells are known as myocardial cells. Myocardium is the membrane. So that is myocardial necrosis. Okay. Now there are 5 or 6 terms which have to do with cell adaptations. These are some of the changes that occur in cells after an insult or an injury, and these are reversible in nature. The first is atrophy. Atrophy, I've explained you earlier, it is diminished size of a cell, tissue or organ, or a part of a organ due to loss of its nutrition. A prime example, a good example, is when we apply a cast to a fractured part, it undergoes atrophy. So atrophy means decreased size. On the other hand, dystrophy is due to diminished nutrition. Okay, atrophy and dystrophy may seem as same, but they are different in the nature. Atrophy is when there is diminished supply of nutrients, when there is decreased function of that part, due to which the nutrients are not required as such as the decreased use of that muscle that leads to decrease in size. On the other hand, in dystrophy, the nutrients are enough for the muscle, but there are some changes in its DNA, in its genetic material, that prevents it from utilizing those nutrients. So in dystrophy, the cells are damaged, whereas in atrophy, the cells are just shrunken, they are just decreased in size. So dystrophy is the diminished size of the cells due to defective genes, due to defective nutrition. Hypertrophy is increase in the size of the cell. In hypertrophy, there is no increase in numbers. When there is increase in the number of cells, it is known as hyperplasia. Hypertrophy is just increased size of the cells. It may be due to excessive usage of those cells. A good example is a bodybuilder who uses his muscles to pick up weights, okay, in the gym. Due to excessive usage of the muscular cells, they undergo hypertrophy, they increase in size. That's why the bodybuilder's biceps and triceps, those muscles are larger in size as compared to a normal individual. Okay, in hyperplasia, there is increase in the size. In hyperplasia, there is increase in the number of the cells. That leads to increased size of the organ or increased size of the tissue. So increase in size of the tissue or organ is common between hyperplasia and hypertrophy, but the mechanism is different. In hypertrophy, there is increased size of the cells, whereas in hyperplasia, there is increased number of the cells, whereas the size may be the same as normal cells. Okay. In hypoplasia, there is decreased number of cells, okay, not size of the cells, number of cells. There is decrease in number of cells. The cells are produced in lesser number. A good example is when hyperplasia takes place in bone marrow. When there is some viral infection or there is some kind of disease in bone marrow, it undergoes hyperplasia. There is decreased number of cells, because of which there is decreased number of production of red blood cells and other blood cells, because bone marrow cells are precursors of development of these cells. Aplasia is when there is a complete failure of development, or there are no cells produced, no new cells are produced whatsoever. So in hypoplasia, the production of new cells is low, whereas in Neoplasia there is absolutely no production. A syndrome is a group of diverse symptoms and signs constituting together to the picture of a disease. For example, in acute immunodeficiency syndrome, AIDS, there is decreased number of T lymphocytes, due to which the patient contracts multiple infections. The patient has diminished immunity, and the patient may die due to these causes. So there is not one factor, there are 2 or 3 factors which are at play in the same disease. That is a syndrome. So syndrome is a group of symptoms and signs which constitute a single disease. Paralysis is the loss of motor power of a part of body due to denervation or primary disease of the muscles. Denervation means when there is loss of nerve supply to a particular part of the body. Paralysis is further divided into different types such as quadriplegia, paraplegia, hemiplegia. आप लोगों ने देखे होंगे पेशेंट्स, शायद अपनी ज़िंदगी में देखे हुए हों, जिसे हम कहते हैं कि लकवा हो गए, या फिर जिसे हम कहते हैं पैराप्लेजिक पेशेंट वो होता है जिसकी दोनों टांगें काम नहीं करती, जो व्हील चेयर की मदद से चलता है. दैट इज़ अ एग्जांपल ऑफ पैराप्लेजिया. क्वाड्रिप्लेजिया जिसमें दोनों बाजू काम नहीं करते, दोनों टांगें काम नहीं करती, दैट इज़ क्वाड्रिप्लेजिया. हेमीप्लेजिया इज़ when there is a stroke and there is loss of one side of the body. राइट साइड का हैंड काम नहीं करता, आर्म काम नहीं करता, राइट साइड की लेग काम नहीं करती आफ्टर अ स्ट्रोक. स्ट्रोक क्या होता है? ब्रेन हैमरेज जिसे हम कहते हैं, वो स्ट्रोक की एक टाइप है. ठीक है. अच्छा, ये आगे लिखा भी हुआ है. It is explained here. Monoplegia is paralysis of any one limb. There are 4 limbs, 2 arms and 2 legs. Quadriplegia, paralysis of all of the limbs, 4 limbs. Okay, so hemiplegia, paralysis of half of the body, one side of the body. Paraplegia, both lower limbs. Okay, so this is paralysis. Now let's go further. Anesthesia. What is the meaning of anesthesia? Anesthesia stands for loss of the touch sensibility. Paresthesia is when there is perverted feeling of sensations. It means there is some sensation but it is decreased in intensity. Okay, so anesthesia is complete loss. Let's suppose a patient has a fracture of knee joint. After that, the patient has anesthesia of the foot because of compression of nerve supply or because of damage in the nerves. If you take a pin and you poke the person over the foot with that pin, there won't be any sensation, there won't be any pain sensation in the foot. That is anesthesia. On the other hand, if you poke the patient with a needle on the foot and he says कि कुछ मुझे साथ में लगता हुआ महसूस हो रहा है पर मैं इस चीज़ में डिफ्रेंशिएट नहीं कर पा रहा कि ये आप उंगली लगा रहे हो या आप चुभो रहे हो कोई चीज़. जब आप उंगली लगाते हो तब भी वैसी सेंसेशन आती है, जब आप चुभोते हो तब भी वैसी सेंसेशन आती है. दैट इज़ पैरेस्थीसिया. ओके. एनाल्जेसिया इज लॉस ऑफ pain sensibility. Anesthesia is loss of touch. Analgesia is loss of pain. हम analgesic medicines भी देते हैं patients को to decrease the pain in some diseases. Thermanesthesia is when there is loss of temperature sensibility in a patient. Hyperesthesia is when there is abnormally increased sensibility. Hyperesthesia occurs at the site of fractures. You cannot even touch the patient at the site of fracture because it elicits a high amount of pain at that site. That is hyperesthesia. Coma is a state of deep unconsciousness where the patient cannot listen to you. Sometimes he can, most of the times cannot listen to you, cannot interact with you, cannot answer you, cannot move his muscles. that is coma. It is a vegetative state. Okay, now let's get to the tumor. As I told you earlier, we're going to discuss the tumors in the end. So a tumor is a neoplasm. The term used is neoplasia. Just like hyperplasia, hypoplasia, the term neoplasia means formation of abnormal new cells, which is uncontrolled. When a bodybuilder picks up weights, he increases the size of the muscle. When a patient eats too much, it results in production of new adipose tissue, in the production of new fat cells. But that is up to a mark, that is up to a quantity. It cannot increase more than that. That is controlled multiplication of cells. If there is uncontrolled multiplication of cells which cannot be stopped, that is neoplasia. That is a sign of cancer. Okay, so a circumscribed means a growth which is surrounded from all sides by some kind of tissue, fibrous tissue or any other kind of tissue. Non-inflammatory, there is no inflammation in these kind of cells. Abnormal growth, uncontrolled growth that arises from body tissues is known as a tumor. It is of two types, either benign or malignant. Benign is a mild form of a tumor or a growth which does not endanger life. It is uncontrollably growing, but it displays slower growth as compared to a malignant tumor. It does not interfere with the surrounding tissue or surrounding structures. For example, a good example is a lipoma. Lipoma is a benign growth of fat cells, mostly occurs over the trunk, backside. एक गिल्टी सी जैसे गिल्टी होती है वैसे बन जाती है बॉडी के ऊपर, बाजू पे बन सकती है, बैक पे बन सकती है, कमर के ऊपर. वो सिंपली फैट सेल्स की एक एक्यूमुलेटेड सी ग्रोथ होती है, छोटी होती है, आहिस्ता आहिस्ता बड़ी होती है, 5-10 साल में जाके थोड़ी बड़ी होती है और कोई थ्रेट पोज नहीं करती वो. देयर इज़ नो थ्रेट पोज्ड बाय दैट ट्यूमर. इट डज नॉट इंटरफेयर विद the surrounding tissue. If it is on the let's suppose forearm, it does not interfere with the blood supply of the muscles of forearm. It does not interfere with the movement of muscles of the forearm. It is just a cosmetically worse kind of situation. बस देखने में बुरा लगता है कि एक ही गिल्टी सी बनी हुई है, ठीक है, ज़्यादा तंग नहीं करती. बट कुछ टाइप के benign tumors हैं which can transform into malignant tumors in the coming future. A malignant tumor is a severe form of illness or growth which is uncontrolled growth, resistant to treatment, ends in death, and it is a rapidly growing tumor, interferes with the surrounding structures. For example, an example is squamous cell carcinoma of the skin. होता क्या है, ट्यूमर है, ग्रो कर रहा है, अनकंट्रोलेबली ग्रो करते जा रहे हैं वो सेल्स. बेसल सेल कार्सिनोमा में भी ऐसे होता है, ठीक है. बेसल सेल कार्सिनोमा में बहुत ज़्यादा होता है. उसमें होता है बेसमेंट मेम्ब्रेन से ट्यूमर ग्रो करना स्टार्ट करता है, वो चूहे की तरह खाना शुरू कर देता है सराउंडिंग स्ट्रक्चर्स को. दैट्स व्हाई इट इज़ नोन एज अ रोडेंट अल्सर. मसल्स को ख़त्म कर देगा, मसल्स में अपने सेल इंजेक्ट कर देगा, नॉर्मल सेल्स के बजाय बेसल सेल कार्सिनोमेटस सेल्स आ जाएंगे, ठीक है. ब्लड सप्लाई को कॉम्प्रोमाइज़ करेगा, सारे हिस्से की ब्लड सप्लाई खींच जाएगा, जिसकी वजह से मसल्स एट्रोफीड हो जाएंगे. डिससेमिनेट होता है. डिससेमिनेट किस तरह से होता है, ब्लड के ज़रिए, लिम्फेटिक फ्लूइड के ज़रिए जाके किडनी में प्रोड्यूस करना शुरू कर देगा. स्क्वेमस सेल कार्सिनोमा, बेसल सेल कार्सिनोमा. लंग्स में जाके स्क्वेमस सेल कार्सिनोमा खास तौर पे ब्लड के ज़रिए स्किन में होता है और ब्लड के ज़रिए लंग्स में पहुंच जाता है, लंग्स में जाके ट्यूमर बनाना शुरू कर देता है. तो बाकी एडजॉइनिंग स्ट्रक्चर्स जो हैं और दूर दूर जो स्ट्रक्चर्स हैं उन सब में भी फैलना शुरू कर देता है. Whenever there is dissemination of a tumor from a primary site to a distant site, just like there is a squamous cell carcinoma on upper part of the lip on the mouth, and it disseminates to the lungs and produces a tumor there too. This is known as metastasis. Metastasis is the distant traveling of a tumor and production of a new tumor on a distant site. Okay, malignant tumors के आगे दो types हैं. One is carcinoma, one is sarcoma. When a baby is developing, there are three layers. We'll study it in embryology. There are three layers from which all the structures develop. There is endoderm, ectoderm, and mesoderm. Any tumor that is of endodermal or ectodermal origin, it is known as malignant tumor. It is known as a carcinoma, such as squamous cell carcinoma. Squamous cell arises from epithelium. Epithelium arises from endoderm. Whereas when there is a tumor of mesodermal origin, that is known as a sarcoma, such as the muscles. Muscles arise from mesoderm. So a malignant tumor of muscles is a sarcoma. Okay. It is further of two types. It is rhabdomyosarcoma, leiomyosarcoma, tumor of smooth muscles, and tumor of striated muscles. So we've finished the general clinical terms. If you have any kind of questions, please let me know. I'll answer them along with the picture. Thank you. Take care.